I ultimately decided to do nursing because I really loved the hands-on care that I got to provide to patients. I got to learn their story. I got to see them every day until they got to go home, and I really formed a great relationship with a lot of my patients. My name is Madelynn Eastham. I'm an RN2 on Dunfor West, our acute transplant unit at Houston Methodist Hospital. I've been a nurse for a little over 3 years. I worked in New York right when COVID hit. I worked there for about a year, and then I came back to Houston, my hometown, and I've been at Houston Methodist almost 2 years now. In the morning, the first thing I do is go to the unit, and I check in with my charge nurse. I get my assignment for the day. I then find the nurses that had my patients the night before, and I proceed with getting a report from them. I then go check on my patients. Good morning, Mr. Morris. How you feeling this morning? Same? Groggy, tired?
Just the pain.
Pain? Okay.
They're working it out.
Do you have any visitors coming today?
Just Miss Terry that I know of.
Awesome. Mr. Morris, he was a liver transplant patient, and we're still waiting to see what his potassium came back at today. His labs are not back yet, but that's the main thing keeping him here at the moment, and keeping his pain under control will be his main goal for today. And so that'll probably take another couple days, and then he'll be able to go home with home health. So he's healing pretty quickly.
Did they say anything to you about a shower or a bath?
You want a shower today?
Yeah.
Yeah, we can make that a goal for sure.
You kind of stinky over here.
Patients often want to shower immediately after surgery. They've been in a bed, most likely prior to transplant, for a little while, and they've had bed baths and wipe downs, but most of them have a primary goal of getting to shower on their own and just feel like themselves again. So you have vitamin C this morning, you have your iron tablet, Actigol for your liver, aspirin, your blood thinner, along with heparin, your heparin injection. Do you like this in your stomach or in your arm?
Doesn't matter.
Okay. Prednisone, your steroid, 20 milligrams. Robaxin is your muscle relaxer, and then Lyrica is the medication, the pain medication I told you that's scheduled. Okay? And then fluconazole is your antifungal. All right?
I don't know how she keeps all that in her head. She's telling me, and I can't even keep up on it. Spots.
Everyone that works on Dunfor is very close with one another. We all work really, really well together, which I think is one of the best parts about working on Dunfor. I never feel like I'm alone or in trouble, or when I'm having a hard day, there's always someone I'm working with that will help me out and has my well-being in mind. Dr. Stephanie Yee is one of the main reasons I wanted to come work in transplant at Houston Methodist. She's one of our primary kidney transplant surgeons, and when I was applying to jobs, I got to talk with her and hear it from her side as a surgeon on why she loves transplant so much and how her relationship is with the other nurses. And I loved everything that she said. She said it was truly an interdisciplinary team, and the nurses and the surgeons and the nephrologists work so closely together that I liked that team aspect that Methodist had to offer. We really like to get transplant patients up and walking and moving if they're unable to walk as quickly as possible after transplant. So one of our major goals is to work with PT to push them as hard as we can without compromising their incisions, to get them up and walking and going around the unit.
Oh, you can give me a spot too?
Yeah.
Short of breath?
A little bit.
How many siblings do you have?
I have 4, and one's passed away.
Sisters?
Yes.
You're the only brother?
Only brother, only boy. And the littlest one, so.
Wild.
That's what they say, but I sure did whoop up on when I was a kid. Especially Terry. Terry used to whoop up on me like you wouldn't believe. They used to stuff me in the fold-out couch and put it all back together and leave me there. That's just here taking care of me.
Celebrations are one of my favorite parts of the job. Every time a patient gets to go home, we hand them a plaque. It has their name, the date of their transplant, which is what we consider their second birthday, and a picture of their new organ along with a poem.
How often we wish for another chance to make a fresh beginning, a chance to blot out our mistakes and change failure into winning. It does not take a new day to make a brand new start. It only takes a deep desire to try with all our heart, to live a little better and to always be forgiving, and to add a little sunshine to the world in which we're living. So never give up in despair and think that you are through, for there's always a tomorrow and the hope of starting new.
So the nurses come in, we celebrate them, the journey they've been through, and we welcome them to the Houston Methodist Transplant family. We've gotten to know the patient and their family so well that we really do consider them a part of our family. And when they come back for labs, they oftentimes come and say hi to us just to show us how well that they're doing. Oftentimes, transplant patients have been in the hospital prior to transplant for days, weeks, months to just maintain their care and to get them ready for transplant. When they finally do get to go home, it's a really big moment for the staff, for the patient, and for their family, because a lot of them didn't think this day would ever come. A lot of them were preparing to pass away when they were in ICU, and so getting to see them go home, and most of them to walk home on their own, is a really big deal, and it's very rewarding for the staff and the family to see that. After being a nurse for about 3 years, I really do find satisfaction in every single day I come to work. There are very hard days, but at the end of the day, you know you did everything you could for that patient. You were able to advocate for that patient, and they're better off because of it. I love that I ended up working here, and I couldn't see myself anywhere else.